First of all, thank you so much for being here so that we can put out this messaging to the community, this extremely pertinent messaging, and I'm extremely excited to be flanked by healthcare leadership from our area. The major healthcare systems are represented here today, and also leadership from the Louisiana Department of Health. The reason that we're here today is because we find ourselves in the third and possibly the most dangerous wave of COVID-19 coming through our community. This isn't just happening in Shreveport, it's happening all around the country. And we, up to this point, have unfortunately lost 440 of our neighbors, our co-workers, our family members, and this has been a very difficult year for us. We understand the burden that it's placed on our families, the burden that it's placed on our economy. We understand how uncomfortable it can be to wear a mask. We understand the anxieties that's throughout our community. And the good news we've heard over the last couple of days are vaccines are being produced and are being effective, but we are a bit away from that. That is the light at the end of the tunnel, and the tunnel is quite long at this point. We've seen that on holiday weekends or holidays, the numbers go up, and that's something that we absolutely cannot afford at this point. So we have to remain vigilant. Shreveport, in Caddo Parish, we're in a unique position. If you look at the numbers around the state, right now our numbers are going up, but when we plateaued, we actually plateaued at a higher degree than what we saw in Baton Rouge and what we saw in New Orleans. So our healthcare systems are being stressed in a way that we haven't seen since earlier this year. Given that we're talking about the holiday season for Thanksgiving, I have to encourage everybody to please only gather with immediate family that you're naturally around. Please continue to wear a mask if you're out or you're encountering people that you don't typically encounter. Please social distance whenever there's opportunities. Wash your hands and all the things that we have been echoing over this year. Whenever you're out Christmas shopping, please avoid large gatherings if possible. Shop online if possible, and you can still shop local when shopping online. So please do everything that you can to minimize the risk of contracting this virus and possibly hurting others. I know this is not normally how we celebrate the holidays, and these aren't, upbeat press conferences when we're talking about restrictions in our areas. But if you think about it, the holidays is about giving. So I'm asking everybody to remain vigilant, do what you can to keep yourself safe, your community safe, and you will be giving protection to those around you. You'll be giving a healthy environment to those around you, and you'll be giving life to those around you. So thank you so much. At this time, I'm going to be introducing Knox Sanders.
Thank you, Mr. Mayor, and good afternoon, and thank you for joining us here this afternoon with our Shreveport-Bossier Hospital and Public Health leadership. This is actually a follow-up to a letter that was published yesterday in the Shreveport Times, a letter to the editor in which we were urging caution to the community as the holiday times are coming up. As you have seen and possibly heard from national media and national health experts, COVID is straining hospitals and health systems around the country. As patient hospitalizations increase from this COVID pandemic, we find the need for resources in these hospitals is getting placed under greater demand, and in some cases there are fewer resources than can meet the demand, and so alternate strategies have to be put into place. Hospital resources that are being taxed, and you've seen in the media, include not only hospital bed availability but also hospital staff. The Region 7 hospitals, I didn't mention this, but my name again is Knox Sanders. I'm the Region 7 Hospital Preparedness Coordinator. There are 31 hospitals in Region 7, and we coordinate with the Louisiana Department of Health and the Office of Public Health to continue to respond to this pandemic. They've been doing so heroically since its onset. In Northwest Louisiana, Region 7, we have 31 hospitals, 14 of which have emergency departments, and so as you can expect, they get a lot of activity from the pandemic. But we have 17 other hospitals that include psychiatric, rehabilitation, long-term acute care hospitals that are also all involved in this pandemic response in one way or the other. And it takes a team effort, that heroic effort that we heard so much about back in March and April. So one way you might get some idea and visibility of the impact is if you go to the Louisiana Department of Health's COVID website. There you can see a lot of data and a lot of information. But one of the things you can see on that website is that we are experiencing our third wave of pandemic, and the Region 7 hospitalizations are increasing on a steady and almost daily basis. You will see on that website there are the three waves. We had our first peak May the 10th, and we had 224 COVID hospitalizations. Our second peak was July the 23rd, when we had 299 COVID hospitalizations in Region 7. Today, November the 23rd, you would see that we have 223 COVID hospitalizations. This is our third peak, and the numbers are continuing to rise. We need to stop that. We need to stop that now. Our request for you is to do the heroic thing. You know, back in the springtime, there was a lot of publicity about hospitals and first responders being the heroes. Well, actually, the heroes are you at home. We need you to do the heroic thing for your family, for your friends, for your neighbors, for your communities. You need to celebrate the holidays responsibly. Everyone is tired of the restrictions that have been put in place. It's sometimes daunting and overwhelming during the pandemic, but we need to celebrate the holidays with caution. Large gatherings with people outside and with other households presents significant risk. Please follow the science. Please minimize those gatherings. Maintain your physical distancing. Wear masks and wash your hands. Please take the load off your health systems. This is important. Thank you so much. I'm going to turn this over to Dr. Trawick from Christus Health.
Mr. Mayor, Knox, thank you very much for having us here today, and I'm going to introduce Mr. Brian Crawford, Chief Administrative Officer for Willis-Knighton Health System.
Mr. Mayor, Knox, and Steen, Dr. Trawick, thank you so much, and thank you for coming here. I'm going to echo what Steen said and bring it a little closer to home and provide you with a lot of statistics and a lot of numbers, but they're important, so I'll go slowly. From a Willis-Knighton Health System perspective, Willis-Knighton has seen more than 60% of all COVID hospitalized patients since the beginning of the pandemic, but we have great partners here. All three hospitals have been inundated with COVID patients, and you won't find a better healthcare system and network with our partners at Ochsner, LSU Health, and Christus Schumpert anywhere in the country. So I'm proud to be standing here with them today and tackling this monster of a virus. And so Willis-Knighton today stands at 88 patients throughout our system. One thing that Willis-Knighton has in common with Ochsner, LSU, and Christus is we're all today and have been from the beginning in the top 20 of all hospitals with COVID patients. And so this is not new for us. But the mayor talked about the third wave. So out of the 88 patients that Willis-Knighton has today, I have about 7% of those patients are critical care patients on the vent. Now that's down significantly than the first wave. The first wave that we had in the April-May timeframe, about half of my COVID patients were on the ventilator. And so new therapeutics, the new drugs that they've talked about, the remdesivirs and the Regeneron and those types of things, have helped drive that off the ventilator rate down significantly. It's also reduced our mortality rate to half of what it was in the early stages. So that's some good news amongst a lot of tragic news that's going on as we see this third wave come through. And so the mayor talked about the waves and Knox talked about the waves. Let me just put that in perspective for you. 3 months ago, the increase that we see today at Willis-Knighton Health Systems and throughout our community in Northwest Louisiana is a 63% increase over August. It is a 55% increase over September. And just a week ago, we're already seeing a 6% increase. So we talked about how some of the challenges that we're having, and we talked about needing to stay home. I can tell you that from a Willis-Knighton Hospital perspective and speaking to my cohorts is we need your help. All of the things that Knox talked about in hand washing, social distancing, wearing your face masks, and limiting your gatherings to those familiar members that you see on a regular basis. I'm going to tell you a quick story, and then I'm going to see this over to Chuck Daigle, the CEO for Ochsner's LSU Health. But just 2 or 3 weeks ago, we had a family came into our Willis Knight and Bossier site who had all been at a birthday gathering approximately 2 weeks earlier of about 30 members of that family. I had 19 people in that gathering come down with COVID, and unfortunately 2 of the grandparents at a grandchild's birthday party did not survive. Those are the things that we're talking about. The vaccine that's on the horizon is just that. It's on the horizon, and it's still a good ways away. We are far from being out of the woods on this issue. And so we ask you to still implore those safety measures going forward. We would also ask that you limit and minimize your emergency department visits to true emergencies. We got a complaint last week for a 3-hour wait in one of our ERs for someone with a sprained ankle. And I can tell you that you're going to wait 3 hours in the ER for a sprained ankle when I've got COVID patients in there that are fighting for their lives. And this time of year, we see an increase across our health systems with people with chronic illnesses such as congestive heart failure, pulmonary disease, cardiac diabetes, and those types of things. And so we have holding in our ER today. I have 10 patients holding in my Bossier facility that are over capacity right now that I don't have beds for because of the influx of COVID patients and those chronic patients that we see this time of year. So what I would ask you to do was, unless it's a true emergency, go to a quick care facility or something, one of the urgent care facilities in the region, or call your primary care physician and make an appointment to go see them. And that helps us as healthcare provider because, as Steen and the mayor talked about, I need to dedicate those resources that I do have. There's a national nursing shortage going on right now, and maybe Chuck can talk to that a little bit. We're all fighting a staffing issue, and as I have to dedicate more of my nursing staff, and we talked about those people. I shouldn't have licked my fingers, but I did, so apologize for that. I just washed them. We talked about the people that are out. I've got 37 nurses that are out today with COVID. I've had 661 of my staff members at Willis Knighton affected by COVID over the duration of the pandemic. And so today our positivity rate for those that are testing positive is 17%. It's more than the national average. And North Louisiana is carrying the load as far as COVID patients for the rest of the state. I'll give you a quick numbers on that. Just last week, Shreveport Bossier had 183 inpatients for COVID-19. New Orleans and the North Shore had 100 patients. Monroe area with 86, and Baton Rouge was 64. So as the mayor talked about, our area specifically, more than just a hot spot, we're an ultra hot spot. And so we're asking you to be diligent over the Thanksgiving and Christmas holidays to protect healthcare workers as much as possible. So now I'm going to turn it over to Mr. Daigle.
Thank you, Brian. Mr. Mayor, thank you. Thank you, Knox, for putting this together. Thank you, Dr. White. And thanks to my colleagues. Thanks to my colleagues in the healthcare community who continue to fight this virus every day, their teams, their staffs, along with the staff of Ochsner LSU. I want to thank the citizens and the community here in North Louisiana, the support and gratitude that you all have shown to our teams in healthcare. It means a tremendous amount. When you look at our frontline staff who are fighting this virus every day and have put so much of their time and effort and have risked their lives, especially in the beginning when there were many, many unknowns. Obviously, we've got a much better handle within the nation, obviously within the healthcare team's collaboration of how to treat this virus, and the outcomes are much better. However, we do have a surge ongoing. This is another surge, as Brian mentioned, as Steen mentioned. This is another surge. We do have rising cases throughout North Louisiana. Over at Ochsner LSU, we've got over 40 patients in-house within North Louisiana, and about 30% of those are in the ICU setting on vents. So we are seeing an uptick. As mentioned, our number of quarantined employees, team members, are up. So the exposure within the community is out there. So please focus on the safety measures and follow CDC guidelines as we go forward. You know, and let's focus on the positive. You know, if we're healthy, if our community's healthy, we can enjoy meaningful gatherings with our immediate households, our immediate families. So I think we need to focus on that. We can support our local businesses, our local businesses by being vigilant about social distancing, wearing masks, and washing our hands. One person can spread the virus through numerous people without knowing it. And so we all need to be cognizant of the dangers out there and that we are into a surge. Lastly, I'll say that 2020 has presented some great challenges to our community, our state, our nation, and the world. Here in Northwest Louisiana, obviously we've had these challenges, and I'm grateful for the team of healthcare providers coming together to fight this pandemic. So still many thoughts, many things to be grateful. So I hope that everyone has a blessed Thanksgiving, and appreciate the opportunity to speak with you today. Thank you. All right, and I will introduce Dr. Savici from the VA. Thank you.
Thank you, Mr. Daigle. Thank you, Mr. Mayor, Knox, and all the executives here. First of all, I want to say hello to our community and also to our veterans, which we have a great privilege of serving. As many have stated, there's a surge going on. We at the VA are not exempt from this. We have not seen a significant increase in our hospitalizations as to date. However, we are seeing increases in our outpatient numbers. We're also seeing a significant uptick in the number of employees, both clinical and administrative, who have the disease. Many of these have contacted it through community involvement. As they bring it back to the hospital, we've had to close down areas because other employees have contracted it from them. So thus it's important that we follow the measures that science has given us. That is social distancing, masking, avoiding large crowds. As we approach this holiday week for Thanksgiving, many of our constituents have lost family members. And if we do what is right and follow the guidelines, then hopefully and prayerfully we can avoid additional empty chairs at Christmas time. But it's up to us as a community to do what is needed. Thank you for this opportunity to speak to you, and at this time I would like to introduce Dr. Martha White, who is the Medical Director for Regional 7. Thank you.
Good afternoon. I want to thank all of our leaders for calling this press conference. I think it's at a critical time. We know that in North Louisiana, we have both led the state in doing the right thing, and now we're leading the state in not doing the right thing. We have the highest numbers of cases. We have the highest numbers of people in the hospital. Our percent positivities are some of the highest in the state. We need to get this under control before these holidays take place, or we're going to be in a bad situation come the new year. We are getting a vaccine. That is wonderful news. That's amazing news. But that vaccine is not going to be available to the general public for months. So we've still got a ways to go. I'm going to tell you a story about Thanksgiving because everybody wants to go and have their big dinners and their family get-togethers, and I get it. I miss my family. We all do. But let me tell you a story. I have a public health nurse, big family, 20 members. They always get together every Sunday after church. They decided to keep doing that tradition. They did it great. March, April, May, all the way through until the end of August, and guess what happened? One of them came, didn't know they had COVID, asymptomatic. 9 of those 20 very sick. 3 of the 20 in the ICU, 1 of them died. All from a simple after church lunch. So what I'm going to tell you is we think we're all going to be that 40% that's asymptomatic. There's 60% that are not asymptomatic. And you don't know whether you're going to be the asymptomatic or the symptomatic, and of the symptomatic, whether it's going to be a flu or you're going to be on the vent like my husband and almost die or die. We are having people die every day. Well, it's not in the numbers we saw before, thank the Lord. It still is people dying. Someone's family member has died today from COVID in this very city. So we have to start taking it seriously. One of the things I always say about Louisiana is we are so good at pulling together in an emergency. We never wait for help. We always help each other. That's what we're known for, right? The Cajun Navy, all of us, we do it here. We do it all over the state. So if we're willing to give each other the shirt off our backs, why are we not willing to put a mask over our face? It's just not that complicated. It's a piece of cloth. And if you do it, you protect yourselves. You're protecting all of these healthcare workers who are literally tired. Y'all, they're tired. They have been working for months, nonstop. Everybody's tired of COVID, nobody more than me. But if you want to see it come to an end sooner, do what we know works. We've done it. The governor called me back in May and said, wow, what is Region 7 doing? Y'all are leading the state in low numbers. Y'all have dropped everything. You're doing great. What's the difference up there? And I said, people are taking it seriously. And then we got tired. And we went into phase 3 and everybody just went, I'm done with COVID. I'm done with wearing my mask. I'm going to do what I want. I'm going to have my big gatherings. I'm going to have my barbecues in the backyard. I'm going to have my friends over. I'm tired. I want to see my friends. I, me. We need to start thinking about our community again and lead this state again in decreasing our numbers. We know how to do it. We can do it. Let's do it again. Thank you.
Dr. White, you want to take any questions? If they have any questions? Or
Any questions?
Good. We covered everything.
Thank
y'all so much for coming. I appreciate it.
Let me ask. Before we go, do you have questions for any of the speakers here this afternoon? Steve, do you have anything else you want to add?
I can talk. We are actually seeing trends just like everyone else. It's going right in line with the rest of the community as well as the rest of the state. So we're seeing that. We're it's very complicated. We all went into healthcare to help patients, and this has caused this to be a little bit more trying and difficult. And as Dr. White said, this is, folks are getting really exhausted, and it's hard to watch that. But we're resilient folks, and we're going to watch it. We're going to recover from this. Everybody just needs to do it. Wear your mask, wash your hands, and stay home if you're sick. That's the most important thing you can do.
Any other questions for our speakers? If not, I appreciate it. Thank you so much for coming.